Private ambulance services are charging £99 opens to tackle patient delays amid concerns over a two-tier system. We're going to read into this exclusive from The Independent, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an exclusive from The Independent with the headline of Private ambulance services are charging £99 opens to tackle patient delays amid concerns over a two-tier system. The exclusive reveals that if my family member is ill and I can't get an ambulance, I want to have a backup, says the boss, Dave Hawkins. Guys, while you're here, make sure you hit the like button and share it across social media so others are notified of this video. Now, it's easy for me to basically say for me to say like how terrible that this is, and I do actually think this is terrible because, and the reason why I say this is terrible because the NHS is no longer there for its people. And it's not because of the fault of the NHS, it's because of the lack of funding, it's because the stripping away of state-controlled things within the NHS and giving it out to private contractors, private health companies. It is essentially all but in name a privatised company, the National Healthcare Service. And we are heading more and more towards this two-tier system where it's a case of if you can't pay, it's going to come. Yeah, that cancer treatment, yeah, you're going to be paying out of your own pocket. As the way we are going right now. But this headline really scares me about the direction that England, in particular, when it comes to our healthcare, is going. Because I completely understand why Dave Hawkins has set this up. Now, you might think that this is a man that's probably taking advantage of people. And that's perfectly entitled to think that, and you might think that. But if you've got relatives or friends or family, and they are not getting the ambulance needed to pick them up, what are you supposed to do? And it's easy to say, well, I'll just get in my car and drive down there, but they could die along the way. This is why you need that ambulance there. And this is not the fault of the NHS, and I stress this again and again and again, this is not the fault of the National Healthcare Service in England. This is because of lack of funding, the lack of planning, lack of organisation from the Conservative government, who, let's not forget, 14 years ago, guys, 14 years ago, before the Conservatives took power, in 2010 with a coalition of the Liberal Democrats, the NHS, the National Healthcare Service, was the best healthcare service on the planet. It was the best healthcare service on the planet. It was. So for anyone who tells you that there were faults or there were problems, you weren't hearing a peep of any of this 14 years ago. Yeah? And I don't want to hear excuses saying that, oh, it's because of the NHS did this or the NHS is that or times have changed. It is a choice. The Conservatives chose to cut the funding of the staff and nurses and doctors within the NHS. It is a choice for them to allow more privatisation. And yes, the last Labour government should have reversed a lot of privatisation as well. And I'm not going to dispute that argument either. But the Conservatives enhanced more privatisation within our healthcare than ever before, which has led us to this crisis that we are in today. The austerity that was imposed, that caused the NHS to get cut to the bones that it has been. This is all this is policy. This is down to policy and decision making from politicians that has led our healthcare system to be the state it is in. Yeah, let me be very clear about this. This is not something that the NHS wanted, does not want private healthcare taking over and dominating. But when there is a void, when people are not getting the ambulance they need, if people are not getting the treatment they need, if people need that aid, they need that help, what are they going to do? They're going to turn to the private sector because they have no other choice. And if it means them emptying their savings accounts in order for their lives to be saved, that's what they're going to do. Nobody wants to dip their hand in their pockets for their healthcare here. Healthcare is a human right, and a human right that we should be entitled to, but it should not have to come at the expense of us emptying our pockets in doing so. We pay in to the National Healthcare Service. We pay tax. We pay a tax within our national contribution and other taxes for a National Healthcare Service. But we don't want to go down this system of some kind of health insurance or a two-tier system. The general public don't want this. But this is being pushed on us. And when you have a shadow health secretary in West Streeting, who is likely to be the next health secretary, given the polling and where things are going in the directions when it comes to policies at the next general election, him talking about wanting to privatize more, we need more to rely more on the profit. He literally said we need to invest more in the. We need more private sector to help us reduce things with the private sector. Does that make sense to you? We need less private and we need more state controlled. Things need to be in the hands of the state, not in the private. There's nothing wrong with having private healthcare, but it should be on the fringes of our society, on the fringes. Yeah, we don't want to monopolize and turn our private healthcare system into some kind of market for the benefit of shareholders of dividends and fat cats who want to profit off our data. We just want to be able to, if we need the healthcare, it should be there for us, and we all pay into it, and that's how it should be. And then these people, I don't know if these people's true intentions are to milk people off their money for the sake of people's health, or if they're doing this generally because they care about people. I honestly don't know, and you can make assumptions on that whether you want to or not. But seeing this really does break my heart. It really, really does, because this did not need to happen. This could have been avoided, but policies and politicians chose to allow this headline, these stories to happen. This one here. It was a political choice. It is a political choice that the Conservatives made on this. So a new private ambulance service will offer faster travel to A&E for those called out by half-day waits for NHS ambulance, the Independent can reveal, in a sign of a growing two-tier health service. MET Medical Ambulance Service will begin by charging £99 for a call-out and can serve thousands of people a week, its chief executive Dave Hawkins has said. Mr. Hawkins, who is a paramedic himself, said he launched the service after seeing his elderly relatives wait too long for NHS ambulance service following falls. It comes as waiting times for ambulance service reach a crisis point in the last year, with frail and vulnerable people waiting hours for the ambulance. Ambulance response times hit records high over 2022-2023, with people who should have an ambulance within 20 minutes waiting an hour and 30 minutes in December 2023. According to estimates from the Association of Ambulance Chief Executives, 34,000 patients were likely to have suffered harm due to these delays. This hit a high of more than 60,000 in December 2022. The latest data shows 940,000 NHS ambulance hours were also lost in crews being forced to wait outside busy A&Es for more than 2 hours to offload patients. MET Medical will still have to wait to deliver patients if they are seen as a priority, but it says patients are likely to be a lower priority that can be dropped at A&E without waiting for a handover. Mr. Hawkins said vulnerable patients waiting for an ambulance can wait up to 12 hours. That's the moment when you're out of options. It's a really horrible place to be, particularly if it's a loved one. It's a shame. You're seeing from the stats and everything. That's the healthcare services failing us. Oh yeah, and while you're on deathbeds and whatever, you're going to be charged £100 as well. Yeah, that part as well. The problems we're facing in the NHS have built up over a lot of time due to increasing demand, aging population, and a lot of staff that have working in those busy environments. Even though they are caring and committed and lovely, people are overworked and they're saying, you know what, I've had enough. I don't know what the solution is to that. All I do know is if my family member is ill and I can't get an ambulance, I want to have a backup, Mr. Hawkins said. The service will cover St Albans and Hertfordshire and has around 25 private ambulances, each of which will be led by paramedics. It has previously provided services directly to the East of England Ambulance Service over the last 10 years. Private ambulances are often used by the NHS for non-emergency situations such as attending care appointments. However, MET medicals will be accessed directly by patients as a backdrop to NHS ambulance services if they face a long wait, and can take patients to private hospitals if they have insurance. Insurance. It will only be for patients who don't need life-threatening or critical care like heart trouble or critical wounds. These cases will be advised to call 999, but for elderly patients who have suffered a fall, it could cut hours from delays. The service is registered and regulated by the Care Qualities Commission. Mr. Hawkins said his drive to set up the new service was after his mum and dad became ill and waited too long for the NHS ambulance service. Describing the incident when his daughter became unwell, the paramedic said it was quicker to get an Uber to hospital rather than a local ambulance. He added, "We carried out several trials in the past and assisted with a variety of patients. In one case, a patient had fallen outside and had been advised the ambulance service would be 6 hours. Our paramedics ambulance arrived in around 20 minutes. The crew found the patient was actually having a stroke and were able to transfer them to a special hospital in time for treatment." Jacob Lahn, the chief executive of social care charity National Voices, said, "Introducing privately funded ambulances to urgent calls would absolutely create a two-tier system and goes against everything the public tell us they want to see. Repeating national surveys and engagement exercises by countless organisations shows enormous and continuous support for a free at the point of use NHS. Nowhere is this more important than in urgent and emergency care." He says ambulance response times are still not being met consistently, especially when the service comes under pressure during the winter. However, introducing a service which could fast-track care was not a fair and equitable response. The NHS needs proper resourcing so it can ensure an ambulance is available for everyone at their time of need, Mr. Lance said. Spokesperson for MET Medical said in response, we can just see the concerns that over a two-tier system, but actually our service is just another help to relieve pressure on the NHS. If you weren't charging people, we wouldn't be having this discussion, would we, about a two-tier system. But while I understand what they are doing is trying to help, and I totally understand that premise, and I generally hope that that is the reason why they've done this, to help people, and I generally hope that is the case. But you are literally going against what the NHS is supposed to be. You are creating that two-tier system just by you're starting that process by doing what you're doing at the same time. It's not to replace the NHS or emergency services. Some people do already have private healthcare, so it's an addition to that. But you're pushing that emphasis on people as well. A Department of Health and Social Plan spokesperson said, under our urgent recovery plan, we provided 200 million. Oh, here we go. We provided 200 million in 2023-2024 to expand ambulance capacity and improve response times, and will maintain that additional capacity this year to further improve performances. They added that they've already been significant improvements in response times with 2 category calls. Those who should have an ambulance within 20 minutes, 28% faster in February 2024 compared to the year before. There is always sufficient private services there if people really need it. But it's just, for me, it's just a part of me feels like I understand why he's done what he did, because he feels that the NHS is failing them, and I get that. But I'm not here. I don't see in this report from him. He's not. Is he calling out the NHS? Is he calling? Not the NHS. Is he calling out the Conservatives? Is he calling out the austerity? Is he calling out what the government's damage has done to the NHS? Is he calling any of this out? I didn't see any of that in this report. And to me, it seems like it seems like when I look at that face here, of smiles and whatnot. Let me just pull this back, right? When I see this. Yeah, I don't see this. I don't see this. To me, it doesn't come across to me, as people who It doesn't come across to me as that they actually are coming out of their way to help people. It seems to me more like an opportunity. That's how it seems to me, because I would have seen if they generally wanted to help, they would be critical of the government, they'd be critical of the 14 years of austerity, critical of what they have done to our national healthcare service. And instead, I see that it comes across to me as more as opportunist rather than helping. That's how I'm painting. That's how this picture is being painted to me. And more on our TVs and adverts, you are seeing they are pushing more private healthcare on people than ever before. They are pushing that emphasis. Because they want less and less people using the NHS. And it really frustrates me. And again, like I said at the start of the video, guys, this did not need to happen. This was policy decision making, politicians' decision making. They chose to allow this to happen. What do you guys honestly think? What do you guys think about this? Private ambulance services charging £99 for service. Is it needed? Is it necessity? Do you think that what he's doing is justified in what his story? Do you agree with me that perhaps he's doing this as an opportunity? Do you think that this should be something that should be rolled out across the country? Or is this a case of let's wait and see what an incoming potential Labour government should do with this and other things regarding our national healthcare service in England? Let me know your thoughts and more in the comment section down below. If you found this video informative, please hit the like button. We greatly appreciate it. Share it across social media so others are notified of this video, and subscribe because it really does help support the channel. And if you want to go one step further and financially support me in the work I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content there as well. Thank you all so much for watching, and I hope to catch you all very, very soon.